Hello, my name is Christoph Schnelle and I'm a 62-year-old PhD student. What has interested me for a long time is exceptional doctors. Because if you're about to have a life or death operation or even just a major operation, would you like to have an exceptionally good surgeon? Or you are a medical student, would you like to have an exceptionally good doctor as a teacher? Or you have an illness that doesn't go away and you have seen several or even many doctors. Would you like to see an exceptionally good doctor, one who has helped similar strange cases like yours? Or you have multiple chronic illnesses and your medications are getting difficult to manage. Would you like to try an exceptionally good doctor who may be able to give you a better quality of life? We found on looking that one question is whether exceptionally good doctors even exist. There is certainly no systematic research that knows what defines an exceptionally good doctor, identifies such doctors, and then makes use of such doctors to improve medical standards. In fact, we did 2 systematic reviews asking a much more basic question. Are there differences between doctors or physicians in their patients' physical health outcomes, even after accounting for all known variables? In other words, are there differences between doctors after accounting for hospital effects, patient risk factors, and even after accounting for all known data about doctors, such as their experience or education? Because to have exceptionally good doctors, you need to have a difference between doctors in the first place. And we found in the systematic reviews that the answer was yes. There is a doctor's or surgeon's effect after accounting for all known variables. This effect ranges from negligible to very strong, depending on what is measured, the type of medical intervention, and how common an intervention is. What we also found is that most doctors fall, as expected, within a range, and there are a few negative and positive outliers. There has been much work in trying to reduce or eliminate negative outliers, i.e. doctors who need to improve, but there is very little research that looks at doctors who are exceptionally good, the positive outliers. Yet, they exist. There is research on what makes a good doctor, which means the doctors who are among the better doctors. A recent review of such research by Steiner-Hofbauer and others showed that good doctors are good at communication, have good medical knowledge, and are professional and ethical. That is a good basis to go to the next step, which is to ask about those doctors who are not only good, but who are exceptionally good, to see if they differ in any way. For example, an exceptional doctor may only have 1 or 2 differences between a good doctor. We have found in our systematic reviews that there are doctors who have exceptionally good patient outcomes. This new research we're doing now and covered in this protocol paper is looking for further characteristics so they can be used for future qualitative and quantitative studies like surveys. Such future surveys combined with quantitative studies may allow the identification of exceptionally good doctors, and there is the possibility that medical standards could be raised if we learn from these exceptionally good doctors or find out how to support good doctors to become exceptionally good doctors. We recommend that you review our protocol paper to see how we are going about finding out what makes an exceptionally good doctor. We have started with the interviews and they're going very well. Very interesting feedback from the doctors. Thank you.